and they've been telling us that the consumption of sugar sweetening beverages is having a lot of effect, especially on children and the young people. And so when the Tax Amendment Act was passed, there was so much of excitement for them, and they applaud government for that, irrespective of other organizations also saying that it's collapsing business and also depriving other. So today they are having their stakeholders meeting to discuss further how they can strengthen this act and make sure that the gains that have been accrued from this particular tax will be consolidated. We have Mr. James Amwa, who is the project lead, to tell us about this particular tax and also what they intend to gain with the pushing of this particular tax. Thank you so much and welcome to GBC News Real Time. Yeah, a bit louder. You've been telling us about the effect of sugar sweetening beverages. Can you briefly tell us why you think that excessive consumption of sugar is having a lot of impact on children and young people in this country, hence the push for this tax?
Thank you very much. So there is enough studies done that shows that if you keep consuming a lot of these drinks, it leads to so many diseases, and especially the non-communicable diseases like diabetes, hypertension, obesity. And today, when we're doing the discussion, we realize that it affects the entire body. It affects your heart, it affects your kidneys, it affects virtually all organs of your body. And therefore, we as Ghana Public Association, together with other partners, the University of Ghana, Ghana NCD Alliance, and Ghana Academic Nutrition and Dietetics, came together to form a coalition called the Advocating for Health Coalition. That is educating Ghanaians that consuming a lot of these drinks will lead to a lot of non-communicable disease, which is killing many people now in Ghana than previous years. And we also are happy that we're part of those who push for this tax, which is supposed to make the cost of these drinks more expensive. And when it's more expensive, consumption will reduce because people are rational beings. If the thing was costing 1 Ghana cedi and now it's costing 5 Ghana cedis, they will not buy it as much as they would have bought it when it was still 1 Ghana cedi. So we are having this stakeholders meeting with a focus on children and young people now, because there are those that if you're able to take them from their childhood, get them to correct their lifestyle, get them not to drink these things, then they will grow not drinking more of these things and they can actually live healthy. That's why we had this meeting today.
Yeah, looking at it's been some few months since the implementation of this particular tax. Have you seen any indication that consumption of this sugar sweetening beverages have come down, or we just
so we are going to do an evaluation with the GRA very soon to get how much money has been made from it, how the consumption has been. But in our conversation, even today in our meeting, there was a man who testified that now the cost of 1 malt is even expensive than the alcohol he buys, and therefore will not buy them anymore. There are friends who engage us and they tell us, oh, because of what you did now, I can't even buy my drink as I've bought it. So on an individual, the passage of the tax has really made the drink expensive, and now they are not consuming more as they would have consumed earlier. But there will be a proper study done next year to do that. Yeah.
But what about the argument also that says that putting this tax on this product also pushes away people out of business? How do you think this whole conversation as well?
So this is an old age opposition argument from those who are into the production and marketing. But other countries have done a similar thing, like in South Africa, in Mexico, there was no job losses. It's now up to those who produce these things to rather reduce the sugar content in their drinks and even produce other healthier options. So stop producing beverages that have too much sugar in them. Produce those that are natural fruit juice and others, which are more healthy. But the point is that they themselves also may drink, their families may drink, and the health problems you are talking about will affect them as well. If your workforce drink this and they get diabetes, hypertension, they will not be able to come to work and give the productivity you need. So they should stop the argument they are saying about people's business going to be collapsed. But now look at how do we now give food that is healthier, which people can eat and stay healthy. That's what the conversation should be about, not necessarily jobless, because there's no evidence anywhere that jobs have been lost with the passing of the tax in the country.
Yeah, you are also a staff at the Kolebu Teaching Hospital, and you work at the renal dialysis department. Just recently, we had conversation with the cost of dialysis, and you in a presentation in there was mentioning that we should stop talking about the cost, but we should talk about the prevention.
Right.
And you said sugar is also a causative factor to kidney disease. Tell us about it, because it's a real factor that we need to.
And I'm happy it's coming up, because you see, it's better to prevent. If you look at this data from Kolibu, for example, the major causes of kidney disease is hypertension and diabetes. These two diseases are caused by consuming too much of these drinks.
Oh, okay.
So the more you consume these drinks, then you get the chance of getting diabetes, hypertension, which at the end will get your kidneys damaged and your kidneys stop functioning, and therefore you need to do transplant or need to do kidney dialysis. And if you look at even the people we see now in Kolibu, they're mostly young people, those who are less than 30, those who are supposed to be active and working like you and I, are in a hospital beds because they have kidney disease. Many of them are those who engage in alcoholism, drinking these soft drinks, who are not exercising their bodies and therefore are weak and can get disease from it. Non-communicable diseases is on the rise globally. And if you don't work on people's lifestyle, including policies like this from government, we can't protect our people.
So what would be the alternative? You say I shouldn't drink my small soft drink that I take after maybe getting some rice or other things to go with. Now, what should I take? I know I should take water, but water might not be enough. What should I take?
So thank you for mentioning water first. Water is important for the body. The kidneys especially need water to be healthy. So water is number one. Number two, go for the natural fruits.
Okay.
We live in a country where fruits abound. Every location you go, there's a fruit there. Get those fruits. If you want something to drink, blend the fruit and drink it.
Okay.
That is more healthy. The body can deal with it than to go for this carbonated and sugar-sweetened beverages, because the effect that will give you is worse than what the body actually needs. So we must be able to go for the natural options. Blend your own fruit, eat your own fruit, drink more water. Make sure that you do activities that will keep you healthy and prevent from getting sick in the near future.
Yeah.
Michael, go ahead.
Yeah. So you were telling us about children who has to make a healthy choice, but it's the parents who need to make those choices for them. And the study you did at the Kolebu Teaching Hospital with regards to children who have passed on, and the surgery suggests postmortem suggests that a number of sugar substances were. But can you continue with that for us?
Yes, I was saying that as children cannot take decisions on their own, so we need parents, teachers to be able to help them make the right choice. And so we must be able to help our parents cultivate the lifestyle of getting to appreciate things that are healthy and things that are not healthy. And the fact that was done in 2015, in 2015, 41% of the children who died in Kolibu died from non-communicable diseases like cancer, like diabetes, and others. And so if 41% are dying from these things, then we must take our action to protect our children and protect also our young people who are growing up. And so there's a need for us as parents, and I'm happy you have people from the headmaster Charles around. You have PT association also here, you have Luke around, and other institutions, people from the Ministry of Children and Social Welfare are all here. Also, discussing this to ensure that we need to get our students to help us to cut a lot of these things that they can see.
But is it possible, or is it a reality where we can do away with sugar entirely, or minimize it? And if we should minimize it, how much of sugar do we need in our body so that we don't go back picking up those diseases you have mentioned?
So in the first place, we can live without it. It's a fact.
You can live without sugar.
There are people who can live without other sugar, not sugar, but other sugar. So we are talking about this sugar. You can live without it. If you don't drink them, nothing happens to you. But you can get the food from the food you eat. So you can live without it. But we must also ensure that as we try to get people not to go into doing this, they get a healthier option that make like eating fruit and that to give them what they need. If you look at according to the World Health Organization, a child who's less than 2 years shouldn't be given sugar at all. But those who are from 3 years to age 18 can be given 6 teaspoons of sugar in a day. That's the maximum they can take. For women and men, women are supposed to like 6 teaspoons in a day. For men, 9 teaspoons in a day. These bottles that we see, some of them have as at 12, 13, 14 teaspoons of sugar in them. And so if we drink one, we've exceeded the WHO recommended sugar intake for that particular day. And therefore, there's a need for us also to ensure that we talk to people about it. Then we start consuming this so that we can actually live healthy.
Yeah, so we are grateful for your time and thank you so much for speaking with us. So, Hajia, it has to do with a consumption in beverage. the WHO recommended sugar levels that you must consume. And when you consume any sweetened beverage, it means that you are also hitting the roof when it comes to your sugar consumption. And the health implications are dire, like Mr. Amwa has said. It means that you are increasing your risk for non-communicable disease in terms of heart attack, in terms of diabetes and tooth decay and all that. And so the agenda is that we minimize the consumption, even possible we do away with sugar entirely. There's something new that one of your participants also mentioned, that you are looking at new policies in terms of labeling, so that people will make those choices. How far is that policy, and how really are we going to get that policy to make sure that it guides all of us?
There's a larger project called the Healthy Advice for Health Life Project. That's being championed by School of Public Health. We are also part of it. We also called UNDP and I think FDA. What we are trying to do is look at other policies, including the sugar taxes, to help protect people. There's also called the front of labeling policy, where we can get the drinks that come into the country, those that are produced in the country. So let the items that are found in it, and then we also indicate how healthy they are and how unhealthy they are, because they must all help consumers to make an informed choice. If I go to the mall to buy a drink, if I take this, I'm going to use and find out how much sugar that they have. So I can buy one that has low sugar, how much salt that this particular biscuit has. So I can buy one that has low salt. So that's another policy that we're working on. In addition, another policy which we also look at how we market our products to children and all others. They are all going to be part of the policy that we are working on. And hopefully when those times get, we also invite all of you to come for that table project meeting. I will share that with all of you.
Thank you so much. Thank you so much. So Haja, at this point, we'll just hand over to you in studio to continue.
Thank you so much, Michael, for that update. Let's quickly go over to the Jubilee House, where President Akufo-Addo is meeting with the German